Yeah, injuries are a natural part of sports. People get hit and therefore people get hurt. But there's one injury that has doctors baffled because it's more likely to happen during a non-contact play, especially when it comes to young female athletes.
Martinez with the jump stop. Ooh, hits the deck. Hope that isn't her ACL.
It was a play Wood River star Keitana Martinez had made 1,000 times.
It's just an ordinary jump stop.
But it was a simple jump stop that ended with Martinez tearing her left anterior cruciate ligament, or ACL.
When I went down, the first thing said is, "You've got to be kidding me."
It was hard for her to believe because for the past 8 months, she'd been rehabbing a torn right ACL.
That was hard for me to handle, and just the change of lifestyle.
The frustrating part, now that we know she's had another injury to her other knee, is during that time her whole rehab focused on both legs.
A Division I prospect on the basketball court, Martinez saw the number of interested schools dwindle after her first injury.
I think the biggest difference was size of schools. Before my injury, I had quite a few Division I schools, but after the injury, Division II, Division III.
KT is part of an ever-growing population of young female athletes who have suffered this type of injury.
Just do 2 more.
According to the National Institute of Health, young women are anywhere from 2 to 8 times more likely than young men to injure the pinky-sized knee ligament.
ACL surgery across the United States is probably the #1 topic covered in most journals. Because of the frequency we're seeing this in all athletes. There are some trends that they're starting to see where women might land with a straighter knee, a flatter foot, not on their toe, not taking the force across their entire knee using their muscles, more just relying upon the joint.
National magazines are not the only ones doing research on the subject.
I also did my senior project on it, and I wanted to document my experience psychologically as well as physically. The thing that you can't really learn from paper, from the experience, is to appreciate the opportunities and the abilities that you have.
Now, there's no way to completely prevent the injury, but there are things athletes can do to try and not become a statistic.
Balance, being more body aware of how their knee works, and understanding that it's not just a kneecap, it's a big joint. Working on direction changing. In women more than men, working on getting their hamstring strength up to help.
And nearly a year after tearing her ACL for the first time, Keitana is still in the process of getting back to 100%.
It's very hard to grasp the concept that it's been a whole year almost. It's going to be a year since I've been healthy, since I've been normal.
Now, she might not feel normal yet, but her hard work on and off the court helped her land an Ivy League education, as next season Keitana will be a member of the Dartmouth College women's basketball team. Now, one of the other things that Koth mentioned as a possible contributor to the increase in tears is the kids are starting to focus on one sport year-round as opposed to playing multiple. Therefore, the same muscles are being worked and worked as opposed to spreading out the stress across all of your muscles.